Welcome to Bridging the Bayou, where we will explore what it means to work, live, and play in the Bayou Region. Join us as we take a deeper dive into the people and experiences that make our region such a special place to live and work. On each podcast, we will talk to individuals who are making our region grow and go, who are making strides in uplifting our community. This is a podcast of Fletcher Technical Community College. Welcome to Bridging the Bayou, the podcast of Fletcher Technical Community College. I'm Kristine Strickland, Chancellor here at Fletcher, and your host. Today, we are joined by Mrs. Phyllis Peoples, President and CEO of Terrebonne General Health System. Welcome to the podcast.
Thank you for having me.
Oh,
It's
so glad to
great.
have you here with us today. And as always, we are going to start with what we call our 5 and 5. It's 5 questions in about 5 minutes, just to get to know you a little bit better. What did you think you were going to be when you grew up?
Actually, I always knew I was going in the medical field. My
Really?
family has a background in medicine, and my dad was a pharmacist. His dad was a pharmacist. His dad worked for Eli Lilly when Eli Lilly was just starting. My grandmother was a nurse, so we have a lot of medical background. So I always knew I was going to do something. Originally, I thought maybe I was going to go to the medical school and things like that, but I determined to go and be a nurse. My dad said, make sure you like it before you go in it, so he had me be a CNA for a long time, and actually it was at Terrebonne General. And so
Really?
it was. So I still have my badge that says Patient Care Attendant, Phyllis LeBlanc. I was a LeBlanc. And I knew that I needed to go into medicine to help people. So after a while, I knew that I wanted to do something even more and got into administration and the business side. My mom was a business person, owned a real estate company, was a broker. So she gave us our business facet. My dad gave us the medicine facet, and I just combined the two.
Look at that. That's
Mhm.
great. Why not pharmacy? Just curious.
Because that didn't interest me.
Okay.
Because I told my dad that is a lot of knowledge for a lot of details on each drug. And now I will tell you, my husband's in pharmaceutical sales. My son's in pharmaceutical sales. My other son's a physician. So we have carried on the medical legacy. And what's interesting is that when we all sit at a dinner table, we can't have one conversation because we all come at it from a different perspective. I'm an administrator. He does drugs and pharma, drug development. My son's in medicine as a physician, so he has a different perspective. And my other son worked in the ER for a while, and he said, okay, it's just best that we just all stay in our corner. And because we have different agenda thoughts, and how medicine is provided. So it works out really well.
I'll bet it's very interesting conversations. And what a legacy your family has had then on this region in healthcare. And it's super cool that you've come full circle, I guess, in some ways, where you started out and now here and currently in your career, you're back home. I would imagine it feels like home.
It very much, and I can kind of elaborate a little. I was born in Franklin, so a small town, and that's where our family was, but moved here when I was in 3rd grade. Did what everybody said they would do. The minute that you got old enough, you were leaving home and not coming back, and I was going away to college, and I'll let them know that. I made it as far as Lafayette and swore that was far enough away. I wanted to be far enough away where your parents had to call before they visited.
I remember those days.
So you got a heads up on that.
Right.
And so, and then subsequently I met my husband at USL. It was USL back then. And then we moved to Georgia for a long time. Never thought I'd be back. And we ended up coming back. Opportunities presented themselves. And so I thought, well, I'm not sure I want to go back to Houma, but it has been amazing. And so I had gone to graduate school several times when we were away and then came back. And I got in a couple of masters, came back when that wasn't necessarily the common thing, and then ended up going for my doctorate at Tulane, and also had this particular, I wasn't CEO at the time, but worked through the organization from the ground up and all the organizations. And so I understand the business from a nurse aide perspective all the way to this particular role, and I hold myself accountable. I keep all of my badges from old past because I never want to say that your title is what makes who you are. It doesn't. You make the person doesn't make the degree, right? And so I know with the swipe of a pen, you can make a lot of rules, but the reality is they're not real for the person who's on the front line. So I try never to forget that. And I work really hard at that. And so I've been in this role as CEO going on it'll be my 23rd year in this role. A long
Yeah.
time, but I love it. I do.
Great.
And I love
Great.
the community and I love why we do it. And that's what keeps me going.
Wonderful. And I didn't know about Georgia, so we might dive into that a little bit further.
Mhm.
So tell me, favorite movie and why?
You would assume I would have time to watch movies, and I don't. So I'll just give you, I love Christmas. Christmas is a great time of year. It was always a big thing at our house. And I think it's just an opportunity to give back to individuals or your family or get to spend some home time. I like It's a Wonderful Life. I always have to watch that. And the reason why I think so is that you say, what if I wasn't here? Or do you make a difference? And every day you don't think you really make a difference. And would it be something different if you weren't here? And I think it sets in his mind that life would have been totally different without him. And I can't say that I make a difference by far every day, but you try. And so what would it be if you weren't there? And so I like that movie pretty much.
Yeah, it's a great movie and a beautiful message for sure.
Mhm.
I admittedly have gotten into the Hallmark. I've gone down the rabbit
Yeah.
hole of the Hallmark Christmas movies. I got on the treadmill one day and got just caught up. So
It's
I'm
all
with
the
you on
same theme, but everybody wins at the end.
exactly.
And that's what you need, that
That's
feel
it.
good, because the news doesn't always make you feel that way. They're not Hallmark.
Yep, that's for sure. All right, tell me something that you've had the opportunity to do in your life that you never imagined that you would ever get to have that experience or do that activity.
I'm not a person who gets to go on vacation much.
Mhm.
I just don't take the time, I guess, or really get allocated the time. So I guess there's two, because another one just entered my head when we were talking. One is we went on a cruise, an Alaskan cruise. My husband, in all these years, he's really been a wonderful support system for everything. My whole family always, because I've been doing this since they were 3, so they don't know it different. And always work became a major proponent of what we're doing. And he said he was going on vacation. He's waited all this time, 25 years, and he's going to make a trip plan with or without me going. I was like, oh, well, he never did that before. So I went kicking and screaming, and it was lovely. It was some downtime. It was a nice experience. It's a beautiful area, something I wouldn't have taken the time to do. Would I do it again? Yes, I would. Yes, I
Wonderful.
would. And the other experience I'd be amiss not to is I became a grandma, finally. I'm a granny.
Congratulations.
I know, and I'm very excited about that. So I get to re-experience the genuineness and just the innocence. When you're working and you're task focused, and I tell that to my son, who's a physician, his wife is too. I said, when I come to visit, this is the only thing I have to do. Is I'm going to sit with him and get to visit with my little grandson. I said, you're feeding him to make it to the next thing. And I did too, and every parent does.
Right.
And my mom used to say the beauty is grandparents have time. And I don't know if I have time, but if I go to New Orleans where they live, that's what I have to do. I don't have a distractor.
Yeah.
And so it's really been nice. It's still new.
Yeah.
But he got born in the snow. He was a snow baby, so we couldn't get to him. And then finally we were able to get to see him a little later. And so he's a joy. He's a joy. He's a big fella. He was born 9/12.
Ooh.
Yes.
Yeah,
ooh.
that's a big baby.
He's pretty much a toddler now. He's a toddler. 3
Holding his own
months.
spoon.
Oh, yeah. They asked what I was going to get called. I said, it doesn't matter. I'm scared of him. He'll call me whatever he wants. So we'll see.
Oh,
We'll
that's
see.
great.
So we're all still learning that again.
Mm-hmm. Congratulations. And I've heard nothing changes your life like becoming a grandparent.
It's still so new, but you're in the routine of every 2 hours they're waking up. So if you're back to going from empty nest syndrome to back to, I go and try and help them so they could sleep.
Yeah.
And I was like, I'll take him at night because I wake up really early every day, 4 a.m. no matter what. No matter what time you go to bed, I'm going to be up. So I was like, I'll take him at that time. And you just get that little bit of quiet time, and that part's actually pretty good. Where they're exhausted, I'm refreshed still because I go home after.
Yeah.
So it's not a bad deal.
That's the nice part.
Mm-hmm.
All right, you can have dinner with anyone in the world. Who would you pick?
Believe it or not, I'm going to say my family.
Wow,
I know
wonderful.
people would say different, but in these kind of roles, and I'm sure you can relate, is your time is my most valuable commodity. People can say, it's great to have education or it's great to have funding or 100 other things. I do that every day. What I don't have is time just to sit down and enjoy your family or hear about their life because I raised them independent. And look, as a mom, I love that. Today, as I'm older, I hate that because they're busy with their lives.
Yeah.
And my son reminds me, both of them, I have 2 sons, to say, Mom, you raised us to be hard workers and be this way. And I call them and say, hey, you want to go do X? And they don't have time. And I said, oh, I wish I wouldn't have raised you like that. Because selfishly now I do,
Yeah.
or I make time.
Right.
They're not at that phase. So if I could get everybody around a table and spend some time together and have some genuine just downtime and their families are expanding and get married, that to me would be the best thing I could do.
Yeah, I would totally agree with that. I was just having a conversation with my husband. Our oldest son is getting married. All 4 kids will be together, and getting all 4 of them in one location because they're spread out
Yeah.
all over the United
It's a
States, and actually
miracle.
one is in England. But
Mm.
getting them all together, we just can't wait. We can't wait just to be there and to just hang out with them.
Right.
And it is because life gets busy and everybody gets going, and the next thing you know, you're trying to find those little snippets of time when you can be together as a family. So that's a great answer.
A lot of people say I want to be with somebody famous.
Yeah.
I don't. I don't mean it bad, but they're accomplished in their own life. I'm just trying to accomplish my own. Just give me my own children and some time. Now, I probably like to be with them more than they are looking to be with you at the phase they're in. But again, I wouldn't know because it's hard to get them all
Right.
together. I
Yeah.
get them one at a time,
Yes.
but
Same.
it's like
Yep.
2 only children, right? Because I
Yep.
only have 2. So, when one's home, the other one's not, and vice versa.
Yeah.
And so I told my husband if we had to do it again, maybe we should have hit that 3 mark or something. I don't know. But because otherwise, when one's gone, it's just one,
Yeah.
and their schedules just have not been able to match up too well.
Well,
So,
I will hope that gets to be something that happens this year for
well,
you.
now with a grandbaby, I think
Yeah.
everybody's settling in. So it's nice.
Good.
It's nice.
All right. Last of the 5 and 5. What is your favorite thing to cook?
Oh my goodness, believe it or not, people don't know that about me. I love to cook.
Really?
I love to cook. And yeah, when I was growing up, both my parents worked in a time that both parents didn't work. As I mentioned, my mom owned a real estate company and my dad worked in pharmaceutical sales. And so we had responsibilities. And I was either smart enough or dumb enough, I'm not sure, but I knew if I cooked, I didn't have to clean the kitchen after. So
Ah.
whoever didn't cook
Yeah.
had to do the cleanup work after. So I was just smart to say, I'll make the mess on the front end. I won't get the back end. So I've been cooking since I was 6th grade or less. And so I'll cook most anything you ask, but more the traditional Cajun things. My husband absolutely loves gumbo. I love corn and crab soup. I can make
Ooh.
any different kind of things. I don't necessarily have a favorite dish. My favorite dish, I'm a meat eater. Grew up
Mm-hmm.
in. I love steak. If you give me a cow, I'm gonna eat a cow. And so that's not hard to cook, but it sure does taste good.
All right. Well, wonderful. Well, good to get to know you a little bit better. So let's talk a little bit about Terrebonne Health System. Let's just start with some basics. Our listening audience, watching audience, I'm sure has some familiarity. But you just all went through a rebranding and reimagining, I think, of the future. Tell us a little bit about the health system today. Who do you serve? Where are you at? Just kind of a general overview.
We did go through a rebranding as a health system because care isn't just given in a hospital. It's given within a community. And as you have evolved, we had to meet those demands too. And we do care for our community. As the largest hospital within the region, it is our responsibility as the way we feel to be able to be a lot of things to a lot of people and serve that community. So although we have everything from cancer, we have a large cancer program, we have women's service program, we have orthopedic program, cardiology, we have all walks from rehab, diabetes management, weight loss, all of these different things. We found that we needed to expand in a different market. So now you'll see we're in the school systems because education is a very big thing, not only for myself. I grew up and that was a high priority in our household. But I had kids who played sports, and you were seeing concussion issues. You were seeing different things, and recognizing that we needed to be able to be that educator for the schools and that support system. So we have athletic trainers in the schools. We provide that for all of our high school things, but we also wanted to be in the elementary schools, because what you recognize is when patients come in, they don't come in with the diagnosis that they're there for. They carry with them a lot of comorbidities, which is other high blood pressure, overweight, diabetes, and that will impact their ability to get in and out or to get care at home. So we want to educate you on that. And so we got to start young. How to eat better, how to eat right, how to make better selections. I noticed that chocolate milk was flying off the shelves, and people said, we learned that at Terrebonne. Now, I like chocolate milk, but I didn't know the why.
Yeah.
And apparently, our trainers were telling people who work out, and some of the school athletes, as they would go to the different schools and talk to the parents, that, chocolate milk rehydrates or re-enhances from a protein level some of these athletes. So
I didn't know that either.
My kids, they didn't get chocolate milk unless they could mix it themselves, because but they have so much education, and it's so cute to see the younger children. We're right next to St. Matthew. We go into all the elementary schools, though, and they'll come down the little walkway, and they'll come into the hospital, and they get chef's hats, and they show them how to make certain things. It could be peanut butter sandwiches or different stuff. But to watch from that age to the next, to the elementary school level, to looking at the high school level, and to people go into young adulthood. Then we recognized we were getting a lot of people 65 and above, and that's a little bit of your more seasoned population. And so we started a program called Well and Wise. And well, because you're well and you're wise and you're experienced, but it is educating them. It is a program that we thought we'd have about 50 members when we started, and we had 100 and something people sign up. And so you come once a month, and we teach you whether about exercise. Remember, we're a city by ourselves. Right. So I can get any kind of physician or education. We ask them, what do you want to see? And so we will have doctors come and talk to them about different diagnoses. We do about identity theft, computers, how to understand all of that, how to be careful on different choices you're making, whether it's food or within safety issues. And we have not really had a lot of people who have wanted to get out of the program. And we need room for the next, so they become ambassadors. And so now we've got a lot of people who are joined. So we try and take care of people through the spectrum. Mm-hmm. So I guess from a hospital, I tell people care isn't within the building. The building doesn't make Terrebonne General Health System. It is only a building. The people make it. And it is our job to get with our community and care for them. And now we have a van that we take down to all of our areas in our region. And that kind of came about after Hurricane Ida. And because, everybody knows Ida was a devastating event for our community, but we had a lot of people who didn't have gas. They couldn't make it to the hospital. The hospital had its own challenges. So our hospitalist, and I can get into a little more detail if people don't know what a hospitalist is, but they provide care within the hospital, and they're there 24/7, round the clock. And so our hospitalist, because we weren't having different inpatients for a month or such, they got in the van and they went down to areas and parked at the churches and would see linemen who might have stepped on nail, or people who couldn't get to it, or diabetics, and they did an amazing job. It was
such a huge gamut of services and just things that you provide to our community. And I'm interested, I know you mentioned early in our conversation that, you have been in the healthcare sector for a number of years. And I'm wondering in particular, because of this new sort of vision, right, of what it takes to provide healthcare within the community, how have you seen healthcare change maybe in our own region? And are you seeing challenges today that you didn't see maybe 20 years ago in this region?
Absolutely. And it's not just limited to this region, it's healthcare at large. Is that healthcare was given in a hospital. You came in, if you needed gallbladder surgery when I first started, you stayed 7 days. They cut down. You're lucky if you're a 24-hour, not even that. It's an outpatient procedure. And insurance companies kind of dictate some of that care. And we were like, how could you do that outpatient? But today, it's very common. And so you can come in, get checked in, and you're going to have, I can do it in essence by a very small incision. I could do it laparoscopic. The way that I'm going to impose on your body is a little bit less, right? And so people are able to get things in and get a lot of care at home, and then they get a support system at home too. So our goal used to be, as you told everybody you were coming to the hospital, send flowers, you set up your room, you all, oh my God, they're in the hospital. Today, our goal is to keep people out of the hospital. It really is to provide care for the least intensive way to get people to feel better and be able to get back to their lives. And we're more active today than we were our parents or grandparents.
Definitely.
Let's be real. As people are aging, the lifespan's gotten a little longer, but the activity span's gotten longer. So the expectation of what people need in healthcare is a little more wellness focused. How to keep you moving, because mobility is a major deterrent if you don't have it, right?
Yeah, for sure.
So a lot of the things we do is try and keep your health for as long as you can, as long as you want to, for lack of a better description.
Yeah. And I think that that's so important. I think about my own mother, who is 88, and she still lives independently, drives a car, gets around, has a social life. And I really do attribute a lot of that to she walks 20 minutes, 5 days a week. She takes weekends off. That's her break period. But just getting out and getting that exercise. And, even her physician said it didn't have to be long. It was just the consistency of it
To move.
and focusing, right, on that movement, on the wellness, on making sure that she was really taking care of herself to prevent the crises, I think, from happening. And it's certainly working for her. I keep saying I want to be just like you, Mom, when I grow up.
Is she here in the community with you?
She is up in New Orleans.
I was like, bring her to Well and Wise.
Yeah, she probably would love that.
She would, because they love it. And they really, we do a lot of things for some of our population. And look, people are, I'm getting there, so I can say it, older, younger, if that makes sense, is because people want to know about health. They want to understand about comorbidities. They want to understand how to minimize. I want my mobility. I want my faculties. And medications are allowing people that opportunity to do some of those things longer, And so, again, that's our challenge, is to always be on the forefront to help people live the life that they want to live.
Yeah. Somebody I know, a very wise person told me I was in the youth of my old age.
Oh,
And
like
I
that.
love
That'd be
that
good. I
way
like
that they said that. I was like, that's pretty clever. I like that. Well, I want to circle back to you were talking about the mobile van, and certainly we have a large parish, and public transportation can be challenging at times. And so I'm interested in how are you providing that health care, the wellness. Maybe you can talk a little bit more about the mobile van or other programs that you have to people who are really maybe outside of Homa itself. And how are we getting down the bayou to bring that education, that wellness to our communities?
There's a couple of things. We have a mobile van and I have a transport van. So I'll distinguish between the two. We have a transport van, and that's if you're an inpatient, and a lot of times people don't have the resources or a family member support system to get them back home. And so rather than stay in a bed or make it difficult or things like that, there's certain circumstances that we are able to get people back into their home environment through a transport. Or the mobile van that we provide care, it's on a schedule, and we'll try and publish that schedule to say we'll be in Dulac or Dularge or Chauvin or some of those other areas that we'll be able to provide some screening services or screening care or things like that. We do have a clinic that's down in Chauvin. We do have, we try and get to the far reaches. We also have a walk-in clinic over in the Schriever Gray area. Of course, we have our emergency department that also has a clinic within it. We're partnered with a lot of our physicians. We either own a lot of the physician practices, or we're partnered with many of them throughout the community to provide care. The other thing is, if you need surgery, we also are part of Gulf Coast Surgical Center and Physicians Medical Center. And so the acute care hospital is large. We're a 321-bed large facility. But Terrebonne General Health System probably employs almost 2,000 employees now.
Oh, my goodness.
Yeah,
I bet you a lot of people don't realize that.
No, we're large. We're large. And so, and we're 3 hospitals deep. because we have physicians, we have Gulf Coast, and we have Terrebonne. And when I say hospitals, let me clarify, we got Terrebonne General.
Mm-hmm.
That's the 321 bed hospital. We got Physicians Surgical Center, Physicians Medical Center, that we're partnered with our physicians who were part of that, and we're the other partner in that. And that's if you need a certain kind of care and maybe stay overnight, but not a long period of time. The acuity, or what that means is the illness of the patient, the acuity of the patient is a little bit less. And so it's got an outpatient, inpatient model. And so then we also have Gulf Coast, which is a large orthopedic ENT, several of those cases, and those are same day. So we're able to fit the needs of any kind of model you may have or the physician's practice at. Yeah. So we've expanded to that. As far as our other wellness, you'll notice that if you go to the heart of the community, we got a large wellness center. That will be our Healthy Lifestyle Center that we are in the process of starting to build the ground on. You have to do that for a period of time to make sure things around here tend to sink. Yeah. So you got to build up the land a little bit. And then we're hoping to be able to get through that particular building by 2027, and open. And it will be an amazing state-of-the-art opportunity for a healthy center.
And what will be in there?
We're going to have a lot of a workout. We'll have a swimming pool. We'll have an indoor track. We're going to have pickleball. We're going to have all kind of different models and education, physician, different seminars, things, equipment. It's an amazing, beautiful, beautiful place. And so we're hoping to get all of that to be in the heart of the community. We also are big on wellness, so we help partner with the sports park that's right there.
Yes.
Because, again, we want people, you got to recruit people to come to Houma. You're in the business of education. Education's big for us. But, again, you got to want them to stay. After they get their degrees and things like that, no matter what it is, you want them to be the workforce in the community, right? Yeah. But a lot of people we find as they ask, what is there to do? What is there for my wife to do or my kids to do or things like that? Or where do I ride my bikes? And we don't have shoulders on our roads.
Right.
People forget that, but that's a big question if you come from a northern area or something like that. There's a lot of hiking, biking, rock climbing. We don't offer that. We offer a lot of great food, though. We definitely can put some pounds on you, but we got to give an opportunity to get them off. Yeah. But if you like to fish or hunt or things like that, we are the mega capital, but the wife will always ask, I say wife or significant other, will ask, tell me about the school system and tell me where I can go to exercise or ride my bike or get out with my kids or have entertainment. Mm-hmm. And so we're a big advocate of the sports park, of course, the education system. And, we take in the provider, the healthcare provider, because we got close to 400 physicians on our staff, too, in a variety of ways with all specialties. So we bond really closely with them, but you got to have some other activities as a family. Yeah, family becomes important, very important.
Yeah, and I know that we're all working to recruit talent. I'm sure you are as well in terms of a workforce, and so those types of things are really important when you're trying to recruit people in from out of the region. To say this is a great place to live and work. Well, one of the services that I know that you all have launched is the Executive Health Services, and I don't think we've had a chance to talk about that yet. Tell us a little bit about that program.
It's a great program. It is a great program. I think it's underutilized to a degree, but we have an individual who does an amazing job, and she'll go into businesses and things, and what it does is it helps you get a executive baseline of health so that people can come in one day and get a lot done. Nice. They'll see a provider, they'll get their lab work, they can get their x-rays, they can get everything because we recognize their time is short. Their time is short. And look, believe it or not, women make a lot of the healthcare decisions within their family. Oh, very much so. You will tell your husband, you really need to go to the doctor.
I do.
They don't usually volunteer.
I was gonna say, I'll be all right.
I'll be all right. And so, again, it's in a business perspective to know they're short on time. Right. Women are short on time. Men are short on time. Everybody today is. They want to drive up or drive through. Think about it. Yeah. And that's what we've created in all models of anything in your expectation, whether it's food, whether it's activities, whether, help me get in and get out. And so it allows a very, very good opportunity to get a lot of things done in a short period of time, all in one swoop.
That's wonderful.
It is wonderful. It is. And we have a team that's waiting for you when you come. It's very much a tailored event, knowing you're coming, knowing what we're going to do, getting to who you see, and then having everything ready for you when you get there.
Fantastic. If people wanted more information about that, or I'm even just thinking right now, the Well and Wise program, they go to your website. Is that the best way to do that?
Get in touch with the main line, and they'll put them through to where they go, and that's 873-4141.
Great.
And we'll get them to the right department and the right people who are always there.
What do you see as the biggest health challenge facing our community today?
I think diabetes is a very large prevalence, not just here, just in general. And I think it is because of um, our lifestyle, our culture and our lifestyle, which none of us would give up for anything.
Right.
I'll be the first to say we tried to cook a lot of healthy things at the hospital, and it didn't go over so well because it's no salt, it's no fat, and it's just
None of the
what we
good
have.
stuff.
No, exactly. So we do have a unique culture that people use a lot of different flavors and butter and things to work through that. So our food is amazing. You just have to balance it with some activity or recognizing some limitations, or think about it. And I'm not saying this in any way, but I have to tell some of our docs who might be getting recruited from outside, and I'll be up front, it's those that you might go into heart failure. And we tend to see a lot of people who need dialysis or heart failure during Lent. And you'd be surprised. And the reason why do you think? We're a very strong Catholic population. And in that Catholic population, on Fridays, you don't eat meat, but you sure as heck will eat an awful lot of crawfish.
Yep.
And you're going to have a couple beers, and you're going to have a lot of crawfish. And they're going to do it because, again, you can't eat meat.
Right.
And so what we were finding is on Saturday and Sunday, people were needing to be dialyzed or were having a little more heart failure. So they came up with a Lenten program where we were able to tailor your Lasix or some of your stuff, because people don't tend to modify their diet as quickly as you wish they would.
Mm-hmm.
Now, our newer generation, I say newer because I'm older, our younger generation may not have some of those demands because they tend to look at protein bars or things. They're still going to have crawfish, but they don't eat all your grandmother's great food all the time, 5 days a week or 7 days a week. And so they'll make some more modifications on that. But we have to educate some of that older population, hence Well and Wise helps, and some of those different things that we see.
Yeah. Talk to me a little bit. Do you have nutritional services?
Oh, absolutely.
If somebody's out there listening and they are struggling with some of these very things, these very topics, can they reach out to talk to somebody who is a nutritionist and can help them understand?
Absolutely. And they are excellent. I have to tell you, they are extraordinarily busy because they are so excellent. And they will actually go and talk to your business or go talk to your individuals. If you needed somebody, they have no problem, and they are a very good speaker. We just had Something Heals for Hearts, where it's about heart disease. And Michelle Bersenio comes and talks about how to eat out and right choices to make and things, because we recognize people are not going to go on what's called a diet. A diet is not, that's the 4-letter word of people not loving, but just no portions, no better choices. And she showed you some of the things you might choose if you went to XYZ place, and how to read the different labels and how to choose. I don't want to use the restaurant she used, but, do you go ahead and pick whole bread versus people think wheat bread's okay? And I didn't know that.
I was going to say, is it not?
It's different. No, one has a higher sugar than another, and one gives you more calories than the other. So you get to eat twice as many. It's not like,
wow. I'm in. Sign me up.
Exactly.
I'm a bread lady.
And so she does an amazing job. So we have our weight loss clinic. It's with our diabetes clinic. And they do weight loss too. And they are very versed, and they do an amazing job. Their goal is not to change your lifestyle. Still just make better choices within the culture that you want to eat. They don't say you have to eat X, you have to eat Y, kind of deal. A lot of people say, well, gosh, you seem to have slimmed down. What I did is I just quit eating carbs and sugar. And it's not hard, but you just got to be used to it. I like meat.
Yeah.
I like vegetables, but I just don't make the choices and I don't miss it. I don't. but I'm going to eat Mexican food and I'm going to get wheat chips. And for my mind, wheat chips seem to be
It seemed to
okay.
be the
And in my
benefit.
mind, so I eat the bag. But that's my point. I'm still going to eat candy, but I'm going to eat
Yeah.
sugar-free candy. I'm going to eat the bag.
Yep.
So it's choices. Now, are those
Right.
good choices? Heck, if I know and I don't want to know.
Don't tell me.
I don't want to know. But in my mind, I'm
Yep.
making a better choice.
Exactly.
The other way, if I eat the sugar one, I get 1. This way, I get 5. So I'm thinking about it that way. But they'll
Yeah.
kind of help you on what motivates you.
Yeah.
And so they do an amazing job. Again, have them call our main number because I don't know all the numbers by heart. We're so
Sure.
big, and ask to speak to our weight loss group, and definitely, and they do, or call and they will come and talk to your business or the more we can get the word out, the better it is.
Absolutely. And he did make me feel good that I could still have a bowl of macaroni and cheese on occasion. Now, he did say that I shouldn't eat the whole box, which I was a little disappointed. Kind of to your point, right, about eating the whole bag. I would eat the whole box.
Well,
but
uncooked you could. See, that's
there you go. But so that was okay. I also wanted to ask about mental health in our community. I know I hear a lot out in the community about struggles people are having and that. Do you have specific doctors or services that help our community address mental health challenges or mental health concerns?
We don't have it as a formalized thing because there's a lot of opportunities in our community.
Yes.
There are a lot of mental health providers. There's a lot of consultations. There's a lot of consultants, psychologists. There's a lot of social workers who are out there. However, we do have a lot of people that will show up at the hospital that are challenged at the time. And so we are able to partner with different entities to get people where they need to go. A lot of mental health is an outpatient. You want to see a counselor, you want to talk to a counselor. And now, believe it or not, you're able to go online and you're able to, a lot of people want anonymity.
Yeah.
And they really do. They feel that it has a stigma attached to it when it does not. And so they tend to keep it internal rather than external until it is at a breaking point. And then they'll become an inpatient or some situation at the hospital. And so we're able, I know Shawbear has a lot of mental health beds or able to do inpatient care. We don't have that as prevalent right now. That is something, there was enough resources in the community when they did. But we recognize that we do have people, we want to get them to the right counselor. And our case managers are amazing. It's led by Joy Martinez, and they're able to get people to the right element of care. And that works very well.
Yeah. You've mentioned that you have a city, right? And I know that city is filled with, I didn't even realize it was over 2,000 employees. And I know they run everything from, we normally think about a hospital system or a health system as doctors, nurses, but there are so many individuals and career pathways that lead to really fulfilling careers in the healthcare. And I think of everything we do here at Fletcher, everything from nursing to respiratory therapy to surge tech to phlebotomy, but also you hire accountants, you have HVAC technicians, you have the full gamut. What are you doing to help continue to meet your needs in the workforce? How is Terrebonne partnering with? I know you partner with Fletcher. Maybe you could talk a little bit about what are your strategies to meet your workforce needs to be able to provide this care to our community?
Well, that's a great question. We truly are a city, and people think of a healthcare provider as being just healthcare, and it's not. The infrastructure has to run, and look, nobody can do it alone. It takes a village, it takes everyone. Just go through a hurricane, and you're not looking for all the clinical people when your building is getting challenged, and the water and electricity and all of those things. So we have facility managers, and they take care of all aspects of a building. And as I mentioned, we got several other buildings throughout this entire community. Those all have to be managed too. So with the number of employees you're saying, it's all encompassing. But we have it anywhere from Chauvin to Schriever to the gray area to the other facilities I just mentioned to large wellness centers. So I got to have the expertise of whether it's electricians or it's HVAC or it's housekeeping, dietitians. I feed a lot of meals every day.
Yeah.
So we have a whole catering, and when I say catering, we got patients that we feed in large quantities, plus all these employees, plus, and they work tirelessly to keep us. Then I've got all the billing portion. You can name all of that,
Right.
whether it's the accountants, whether it's the billers, whether it's coders to do
Mhm.
the chart. I need a whole IT department to be able, everything's computerized today, everything from the medical record to the billings to anything we do. You got to have risk managers, we have lawyers, we have, and they're all, you could name almost anything you do in a normal workforce, and we have it probably internal. Architects, things they're not on staff, but they pretty much are there because we're always doing something to a remodel or build to signage, and I could go on and on. How do we replenish that? Well, again, in some of those fields, you try and promote from within. Absolutely. We're a big advocate of promoting from within, allowing people the opportunity to grow within their role. And I tell people, they say, well, how do I get a job at Terrebonne? I said, get your foot in the door. It may not be the job you want or you're looking for, but it will be a job that once people know you and they know how you work, we always advocate for those that we've already worked with because you know that they are very much stellar. Most businesses probably do, but we always looking for talent on the outside, very much so. And healthcare is an emotional business, and when you're on the bedside, we call it bedside, patient facing.
Right.
That's whole one aspect of the building. The other aspect runs so you can give patient care. And that's a whole different aspect of the building. And so some we have to promote from within. Some we absolutely are always looking for talent, absolutely to come on and join the family because we've got a big one. So we partner with schools, we partner for internal, we help mentor. We try and get kids that are still in high school to see if they're interested in healthcare. But the things they identify with are some of the positions you just showed. But
Right.
there's a lot of people that may not want to be patient facing. And we're trying to do a better job at understanding that there's a whole nother aspect to this and that we've got the city infrastructure that manages. We do more internal construction, I think, than because we're always growing. We're always growing and fit needs. And so we have carpenters, we have every single walk of life, I think we pretty much have at that organization. So we utilize internal education, we do scholarships, we offer tuition reimbursement, we help advocate for those that might start in a role and want to do a different role. As I mentioned, we partner with the schools. We're in the high schools. We try and do career days. We try and anything that will keep our community wanting to come back home, wanting to come back home. And then we have entry-level positions that may not need, they just need training. They don't necessarily need formal school because there's a place for everybody, and we have that too.
Yeah, those are great benefits. And, I think about that workforce development piece, and there are individuals out there who really want to be involved or working in an environment where they are helping. They're in a helping profession. They may not see themselves as a nurse, but
Right.
to know that there are those opportunities to be of service in that capacity, whether it is your medical code or a biller or accounting or HVAC, right? That those are all opportunities there. And, you all have been such wonderful partners across the board in all of these programs. We've had you all come to our HVAC and our electrical meetings, as well as
Yep.
to our nursing,
Yep.
allied health. Maybe you could talk just a minute about why is that partnership with your higher education partners so important? Why are you vested in being so involved with us?
Well, I'm passionate about that. I really am. And the reason why is because, again, I think, when we're all raised, is that you know that you want to do something with your life, and it starts young. And to me, it's a way in or out on whatever you want to accomplish. So either education will be or a good job. Either way, you've got to be able to provide for yourself, eventually a family or whatever. And so the reality is, to me, we need to take it upon ourselves to make sure I don't know, I don't want to speak for you, but you're naive when you're young.
Yep.
And your parents do a lot of things, and you're like, oh, how hard can that be? I've spit up in the air many times, and now I'm enjoying watching my own kids say, it
Yeah.
can't be that hard. And I'm watching the aha moments, is what I call
Yep.
So my point is that we have to partner with our higher education. We have to be proponents of that. And whether it's the elementary schools, whether it's the high schools in every walk, or the advanced schools or higher education, whether it's trade, college, even after college. We have to be a part of, because I have education levels all the way from a super specialist to an entry level position.
Yeah.
But it takes both to make the place run. One is not more educator important than the other, because life education is a big one too, right?
Absolutely.
And I have a lot of entry level people that may not have the formal schooling, but they are very intuitive. And so everybody has a value that they bring to the table. But we want to give opportunities. So to me, the partnership just allows that opportunity. It's one of the amazing opportunities to allow people to further their life to what they want it to be. And they're going to have children, and they're going to be a proponent or not of that. But if we don't allow them the opportunity for success, and that's what y'all are built on in your mission. I profess for Fletcher, for Nichols, for any higher, but at this level, what happens is that I'm going to work around your schedule. I recognize you've got other stressors. I recognize you might be a single mother. I recognize you might not have the resources. And y'all do an amazing job of working around their schedule, because they have to work. They have to work to feed the population or their families. Yeah. And you will do whatever it takes to give them a different or better life, to provide for it. And that is an amazing thing, and we try it. I'm just not in the educational facet, so I can support it. But I need the education or the skill to be able to provide care to the community.
Yeah. Thank you for recognizing that, because that's one of the things we are passionate about is really providing opportunities for all people in our community to be able to find their path, to be able to find whatever the education or training that they need is to do that thing that fulfills them. And I think there was a recent report out that I just read. I thought this was pretty fascinating, is that they talked about the relationship between the professional, the highly skilled, and the entry level positions. And most recently, I saw one that came out I think it was along the lines of, for every one PhD, there are actually 10 to 12 positions that are supporting that person, whether it's in the medical field, right? So a doctor who has nurses and physician's assistants and medical coders and billers and all of the people who make what that doctor is able to do in that patient room possible, to those who are doing research, right? And so it's pretty fascinating to look at sort of that whole ecosystem. Absolutely. And what it really does take to make an organization run and to help a community really thrive. And so I just want to say we so appreciate that support that you provide to us that enables us to do the work we do as well.
Oh, I'm a firm believer. When I got out I was a nurse. When I got out of nursing school, I remember somebody, I always try and remember where you came from, because you can't get caught up in what you're doing today, because it made you who you were, where you came from. And I remember getting out, and they say the people you need to appreciate the most are the unit secretaries, the CNAs, the techs, the people who, because you're taking care of the patient, but they're filling in all the stuff. And if somebody's not getting their food, if they're not getting their bath, and the room's not clean, as great as your skill might be, the impression of the patient is going to be bad. And think about it.
Yeah.
Because what people can control when they're in the hospital, they don't understand how the monitors work and the technology and all of that. They're not supposed to. We do. But they sure know if their room's not clean. They sure know if their food was cold. They sure know and that's a lot of our complaint system. I say a lot. We don't get a ton of complaints all the time. But my point is, what you look at is things that the patient can control. Yeah. And so I tell all of our positions in that is, you really you're setting the impression of somebody's good stay.
Right.
And so you got to have pride and go in and recognize that. And so, because people aren't going to say, well, they took my blood pressure late, or my medicine didn't work. That's not the complaints you're going to get.
Yeah.
It's going to be, they didn't get my bath, and, they didn't get whatever, and they came late. And so those are things you could evaluate and have control over, and you should. And that's what you'd be doing at home.
Yes.
That's what you'd be doing at home. So we have got to be able to do that for a lot of people. And I can't say we always are amazing, but we try. We try to be amazing, but sometimes a patient might be going bad in another room, or sometimes there might be something that people won't understand that's happening with another patient that might have a slight delay. And it's not our role to say, well, you should have seen Miss Smith. She was really going downhill. So, we'll just say, I'm sorry, we'll kind of move forward, right? But it takes a village, and we very much appreciate what everybody does in every part of the organization.
Great. I want to take a minute to talk about, I have often and for as long as I have been here, admired your leadership. And I'd like to just ask you, how do you view your leadership style? What's important to you in leading this organization?
I think I am very, very big on communication and front facing with somebody. You know, technology has gotten where you could send texts and you can send emails, but I'm a walk around kind of manager, if you want to call it that to a degree. I'm a firm believer, and if I have an issue, I'm going to come find you. I am, and you're not going to have to find me, or I don't summons people. It's not like I don't have meetings, but summons people to the office because we really need to talk. I go and look for whether it's physicians, things. I'll say, look, I need your opinion on an issue. Do you mind giving me a call when you get a chance? And they always are very, very good. Nobody gets into healthcare because they want to do a bad job. They might have a bad day, but nobody wants to care for other people and then say, I'm just going to be really bad at it. You know,
Yeah.
you don't go to that much school or that much stuff and not. So I always tell people, again, to me, I appreciate emails, I appreciate texts, but go find them. After you've had one or two emails that might have been, people can read into it differently. But I'm somebody who's very driven by relationships. I'm a big advocate of that. And I go and find people to sit down and talk because I'm a firm believer in all my time there. I'm not saying that I'm a pushover because that won't be it. And I tell them, but again, if you've got something to say, come bring it to me. But the only thing I ask is the way you talk to me is the way I'm going to talk to you.
Mm.
And so we need mutual respect on this one. And so if we're okay on that, I'm in. I'm 100% in. And I have to tell you, in all my time, at the beginning, you might have some because you didn't have very many women in this role. And I'm not advocating that that's ever been a limiter for me, ever. But I said, I know you're passionate because everybody is. They're passionate about taking care of a patient. But all I ask is tell me your gripe, tell me your concern, because it really is about the patient. And I'll tell you, we can make it different, you know? And I'm a firm believer that with the same information, I don't hide information very well. I don't do that. I'm pretty much an open book. Well, with the same information, smart people actually will come to the same decision. It's just we each have a different amount of information. Your agenda is different than my agenda. And so we're going to look at it from different perspectives. But if we sit down, we might indeed come to the same, or I'll tell you what I can and can't accomplish, and I'll tell you the why. It might not meet your need, but this is where I'm at. And this is why I have to be there or not. And in 23 years, 23 years, I started this in 2003 as CEO. Been in healthcare a lot longer than that, but I've not had lines in the sand. I really haven't. That we haven't been able to march through and work through. Yeah. And so that's what keeps me coming back is the people. I really enjoy the people aspect of the role very much. And so I guess if you call it leadership, I'll go in the doctor's dining and I don't wait for them to find me or fuss on the floor, which they don't, or I go eat. I go find them and say, I can cure 8 meetings in 15 minutes. Oh, wait, you stay right there. I got you.
Yeah.
Okay, hang tight.
You're
Come
next.
on. Yeah, that's exactly what I do.
Yeah.
You're next. Wait, don't go. Okay. And so it's really just tell me what's going on. Tell me what you need. I understand that there was something that we could have done a better job on. Talk to me a little bit about that. And, and then if it's deeper, then we have a bigger conversation. But it's a touch point. It's a touch point and make rounds in the hospital. I wish I could make them more. I try to visit patients or recognize when they're there, but again, unfortunately, the role demands a lot of times either Baton Rouge or out of the building or somewhere else. And so you try and be everything to everyone, but it gives up time somewhere. Yeah. And whether it's your home or your family or something at work, and that's why if I ever got time, I'd like it with my family because that's more of a gift. I tell people nobody lives at our house. I think that's my vacation spot because you don't get to be there,
Yeah.
So
being home is a joy.
Being home is a joy. Shut the door, shut the gate, and have it to yourself. I love it.
Yeah. And I so agree with that point about I'm with you that no one shows up to say I'm going to do a bad job or I don't care. I think vast majority, 99% show up on day one and are thrilled and excited about the work they're going to do. And I think a good leader figures out how to tap into that. Um, but I think to your point, recognizing too, people may have a bad day
Mhm.
and we have to have forgiveness and we have to have some understanding there. But I also think that aligning people to make sure that they're in the right job for who they are and their skill set is so critically important. And if you can do those things, if you can reach that alignment, that's when you see organizations really start to have some success like you guys have had.
Absolutely. And look, the bigger you are, the harder it is. You know, you rely on all your directors or your other managers or people, but you hope that they're somewhat in the likeness or your philosophy or the
Mhm.
culture. And when we are bringing new people in, I'm very upfront, whether it's physicians, because I tend to be on working with that level a little more. And what I tell them is, look, in a lot of organizations, they're able to put referrals in the computer, Epic or otherwise. You never know the other guy on the other side. We're
Mm.
not a transient community. We're not. You're going to see your patient at church, at the ball field, at school, at something else. We talk. We still talk. So if they're going to go related to your care and you're uncomfortable with that, I'm telling you, if you're referring to the surgeon, a lot of times they'll call and say, "Hey, look, I got Miss Smith. She's been my patient a long time. Yes, I put it in the computer, and yes, it has to go through the process. But a lot of times they'll still talk. Or, oh, did you see Dr. Strickland? I was taking care of her." But and they'll still have conversation a lot. So I tell them, if that makes you uncomfortable because you come from an environment that does it maybe new school way because everybody's technologically advanced and they're used to that, this might not be your fit. I'm very upfront. This Our fit is everybody's going to tell you hello in the hall. Everybody's going to come. Recognizing any situation. As we had a recent conversation, I'll pick up the phone and call a dog, and then he'll pick up the phone and maybe call the patient. You
Right.
know, but we still talk a lot. And I had a patient come in and she said, I haven't seen that in a long time. And it just depends where you are.
Yeah. So, and I was going to ask that question, but you actually touched on it. It's a culture that you've created because I think you can go sort of too far to the high tech. And it is that balance of high tech and high touch. And I often tell our team here at Fletcher, it is about learning how to utilize the technology so that you can give that specialized attention
Yeah.
to the individual who needs it when they need it. So I think a lot of times before we had the technology, we were just sort of having to hit every single person in the same way
Right.
because of the volume. But where technology really can improve organizations, I think, is where you can figure out how you can allow people to do things independently, to access information or, portals or email communications, right, that may save time. But for the person who's right in front of you who really needs that
Hmm.
personal high level of touch, you're able to meet them there. And to me, it sounds like that's a culture that you're working really hard to create and sustain within Terrebonne.
Absolutely. We won't lose it. At least, it's a philosophy we had. When I assumed it, it was back a long time ago. And that was the norm.
Mhm.
It's a Cajun culture here. And it's about faith, family. I tell them fun and food. Uh, and it
The
is.
four F's. If you're not, if you're following along
Yeah.
at home, write those down.
And that, yeah, there might be others, but we're not doing that. It's faith, family, fun, and food. And pretty much not always in that order. It just
Yeah.
depends. It just depends on the individual. But you can't have a meeting anymore without having food. Think about it.
Yep.
That's where we sit around and talk. It is the culture. And so a lot of people will sit down, and whether it's lunchtime or things like that, and they're talking about different patients and things. And oh my goodness, let me give you a call. Or oh, can I go walk over and we look at the x ray together? You don't see that in a lot of places because technology has taken, and again, they're transient because you might come on and it's a much bigger city. And in a much bigger city, you may not know everybody within, right?
Mhm.
And so here, it's different. It's different. And when I say it's different, I'm sure there's a lot, but it's the culture that we have. People expect you to be treated like family. I expect to, my family was here. Unfortunately, my mom and dad both passed away. They were from here, but they got care at Terrebonne General. And, again, you knew the care that you're going to get because you knew your doc since you were forever. I mean, how many people? We got docs on staff that have been there 50 years.
Mm.
I have third generation physicians,
Oh,
and a lot of
wow.
places don't have that. And so that has very positive things. And at times, not today, but in the past, you'd have grandpa, son, and grandson who would all be on staff. Now, if grandpa didn't like what was going on back in the day, grandson seemed to be picking up the charge. And I was like, I wasn't even born, so we're not going to do that. And the other philosophy I have is once you're on staff, you're always on staff as a medical provider. So we'll still invite you, whether it's Doctor's Day or any kind of recognition program or whatever, because again, you help make the organization who it is. You know, it was in there for 50 years when I got it. Well, we're doing our 70th year, and they help be the foundation. You know, and so I said, we don't throw you to the curb. We just ask you to be honorary, you know, as you retire, and we still call you. And we ask you to attend things if you'd like to. It's all open. And even if some of the husbands who have been there on a long, long term, their wives still will come because that was their thing. And so everybody knows, I think at this time we had Dr. Ray Sonata was one of our longest serving physicians. Unfortunately, he passed away. Dr. Dickey is now a very long serving physician. And he knows, I think he's seeing people's grandchildren, you know, now, but his sons are with him. And so you've had that Hato name, you have the Brown name, you have, they've been a long-standing, multiple generational, you know, people. We have our own employees. That's another reason when you asked about workforce development. Our own employees have kids that go into medicine. Let us know and we'll reach out to them because we want to advocate their success, right? And so, like me, I'm a third generation, or my son, I guess it'd be fourth generation in some kind of medical field because there's so many opportunities. You could be almost anything in the medical field. And if you just want to help people, there is a calling somewhere, whether, like you said, whether it's a CNA or an entry level and progress up. Right. You could spend a lifetime in a lot of different positions. And so it works. But yeah, everybody still knows everybody, and you still walk through the halls. And, you know, when you go home, you're a little tired. You've talked to everybody. Right. And you kind of just say, okay, I'll take some downtime. But like I told somebody yesterday, I see the whole community at work. I don't need to go to a lot of stuff after. You know, now, unfortunately, I hope you're not sick.
Yeah, right.
But when people say, so how's work? How's things going? I'm real hesitant to say it's awesome because it means somebody's sick. Right. So I'm always like, well.
You're balancing it.
Yeah. We're doing okay. And hopefully our patients are too, but we're busy. We're really busy. Yeah. But things are more outpatient today. They're much more outpatient. And that's awesome too.
Yeah. And it just reminds me, you know, one of the things is that I love is the sense of community. And I think that's one of the special things about our region is that it is a community. I think most people want to be seen. They want to know that they have people around them who care about them and love them and are concerned about their well-being. And oftentimes that happens most especially when someone's faced with an illness or some other challenge of that nature. And so that is one of the things that I think makes our community special is that we do have physicians. We do have members of our community who are involved in the healthcare system, who know what it means to live and have fun and food in this community, and see you because they know you. They know that you're their neighbor or you know, a colleague or a friend of a friend or, you know, somebody who goes to church with you. And in that those are really the ties that bind us together ultimately as a community.
There's a key question that used to be asked, and when I was younger, I didn't get it, you know, but again, I was much younger. And, you know, the first thing people are going to do when they come in is they say, now, who's your mama? If you think that's the common question around here. Now, who's and everybody's looking for, I know you, I know that last name. And so they search for it until they find that connection, whether it's their caregiver, whether it's their doctor, whether it's the person serving their meal, or, you know, oh, wait, you're whether a Cajun named Bergeron, Abe, or whatever. Who's your mama? And so that, I never noticed it because I grew up in this culture, right? But if you're from the outside, they're like, well, you wouldn't know my mama. She's, you know, but everybody's trying to find a familiar connection, because people feel better when they're being treated like family, or, hey, I count. I mean something. I want to be respected. And that's something we always try and advocate for.
Yeah, and that is such a great point because I am from Ohio.
There you go.
So I do get the question about who's my mama and what's your name and who's your family, and so there aren't those connections. But what has amazed me is that so often, like you said, the community continues to find a way to connect.
Yep.
And so the number of times it'll come up and I'll say I'm from Ohio and they will find a relative, someone, oh, my wife, did you know my wife grew up in Ohio, or we have family in Ohio? And so there are these connections.
They have to find it.
That we seek, right? And look, for a person like me from outside of the community, those are the things that made me feel so welcome, because it was somebody who had something relatable to me in my experience, that then we built that bridge off of that connection. And that's what I think is just really cool about where we live, where we get to live.
You can't do it anywhere else. And look, the Cajun culture is very enveloping. They're going to invite you, and I tell them they're going to invite you to their house. They're going to invite you to Mardi Gras. They're going to invite you. They will take you in 100 times over. Yeah. And I can say that, so I'm not speaking out of turn. I was a LeBlanc, I get it. However, if you treat them badly or you wrong them, you ain't never coming back, because a second chance isn't in the cards. Well, and so I tell some, to your point, if you would come to work for me and you're from Ohio and people I would always tell them, okay, I'm from Ohio, and you could see they kind of look, but I married somebody local, or what, my dad, oh yeah, now who's their mama? And immediately it will redirect. Or I live here. What neighborhood you live in? They're going to find it. And it's just who we are, because it's a community connection. It is very much a community connection. And you can't stop it. And that's what makes it amazing here. I wouldn't want it anywhere else. It's just an amazing place to be.
Yeah, exactly why I can't imagine living anywhere else.
I know.
So let's talk just a minute about the future. When you think about the future of the health system, what are you most excited about?
I think I'm most excited about what's coming up. Every year, healthcare is ever changing. It is not a business you get in that every day will be the same. It never. What's on my agenda for the day has yet, in all these years, be the thing I work on, because at a moment's notice, it will change. We have, whether, you have certain regulations to work, or you work in the school system, so you recognize, but a bill or a law or something will change funding, or you'll go in that direction. You have AI out now that everybody feels like AI is going to have an impact on the medical community, because it's information, and will it enhance it, or will it limit it, or how will it be? That remains to be seen. I think it's like what you said at the beginning, is technology is a tool to be used. It is not a replacement. People still want to be touched, and we're emotional beings. Right. We still want the emotion. It's great to have the information, but I don't know that it can replace everything. It can give you information, but what people forget is, as talented as AI is, what's trash in is trash out. You're going to get the answer. So you really want to make sure that wherever it's getting all its information from is pure good data. And that's still having to be worked through. So you've got all of that. You're watching lives live longer. But are people cognitively still enhanced to, your body might, but sometimes, Alzheimer's is being a little more prevalent, dementia. But now they got medications that are coming out for that. And so that's enhanced people to be able to have, I guess, a little bit more of, so where does that get you? And so what we're offering today won't be what we'll be offering in 10 years, maybe 5, because it's just whether we can afford it or not, because that's where healthcare always is. Today, what I can figure out for you, I can do a scan, and things that were very invasive, I can look and we can find a PET scan, we can find things, we can find where your cancer tumors are, without ever having to cut. We can have you glow, and we'll find it all. But again, what's the expense of several technology things? Because they're getting more and more and more expensive. The medications are getting more and more expensive. And this is the debate on dinner table that we can't have at my house.
Yeah.
Because they are getting more and more expensive. And I'll say, what's research and development? I know, but if the consumer can't ever afford it, at what point does it become cost prohibitive?
Right.
I know, but it's research and development. I know, but administrator can't afford it, you know? And then the physician says, but I want to order it. And then my youngest says, would y'all stop? Because this is going to go downhill.
This is supposed to be good family dinner.
And it's not going to go downhill. It will. And so, yeah, so you could see, and then somebody represents the patient base because an insurance says, I can't afford people to live that long. That wasn't what I anticipated. And I don't mean it in a bad way.
Right,
It's just an expense issue. And I can't afford the drugs that are $20,000 a dose. And, you know, that's what you're set at. So at what point is there going to be the break even or where it stops or where it doesn't? And, you know, is government going to get involved, which none of us always want? So I think, but we've been doing this since I got in medicine. It was just different. It was the same problems, but the technology wasn't as advanced, but it was advanced for its time. So when people say this has just got no means to an end, well, you know, our parents always wonder what we were going to become if you think about it. Loud music, this, that, long hair, not long, and we survived. So I said, it all evolves. It evolves. So you just got to hang in there long enough to be the people who are making the difference. We don't have the answers, but nobody did. And so, but you got to be willing to play the game. And are we willing to play the game? And our future, the people that we're investing in to get educated, because they'll be taking care of us. So I'm really investing in them.
Yeah.
I want you to train them really well because that's going to be our caregivers as we get older, you know? And so anyway, I think it's interesting, but I think we don't have a crystal ball, but will we try and be in the forefront? Always. Do we keep ourselves there? Always. Will the new educated individuals coming out of school say, I got the best idea ever? We've been hearing that for 30 years.
Yeah.
And so it will all happen. It's just whether we're on for the ride.
Well, we are lucky that you are along for the ride and leading that evolution for sure. So I like to do a little homework, and you touched on one of the things earlier, and that was your love of Christmas. I have to ask, we had another guest on who had 5 Christmas trees. How many Christmas trees do you put up?
I'm close.
Oh, okay.
I'd say 5.
5, all right.
5, but I'll take the disclaimer. I have help to help me do that because I don't have time. But yes, and they all had a reason why they got there. I'll give you a short answer.
I was going to say, are they themed? They have a reason? Okay, tell me about these.
No, that's not my style. But when you're young, and we didn't have kids for about 5 years that we were married and things like that. So you set your household to match, right? Because you're young. And it all matched, and it was a non-touchable item. And then what happened is you start to have children. And I don't know about you, but when you start to have children, they pull and tug at everything. So we needed a different little tree that they could pull and tug on and things wouldn't break. And so it's a children's tree. And in the children's tree, which has become our favorite tree, by the way, our children's tree is anything they made or anything they wanted got stuck up on that tree. And so it's plastic ornaments or, you know, they're nice. And then it got to be, as they got older, any trip or thing, everybody had to pick an ornament to reflect the year. And so whether we went on a trip or whether they had something or one got married or whatever, you know, we have a reflection. And you can go through the tree and say, oh, I remember that. But when they were little and in preschool and first and second, you know, they make those little ornaments with their pictures on it. That's still on the tree. And so anyway, and then we ended up adding on to our house, and we never went to the front of the house. But these trees had a place. You couldn't move them. So they said, Mom, there's nothing back here. It kind of looks lonely, and we kind of live in the back end of the house.
We need a tree.
We need that because my kids were smaller, but we had a pool, and I wanted to have eyes on them. And so the front area was a little too far for me. And so you want to be able to see them. So we put up a little pencil tree, so that one got there. And so now, as my children have gotten older, that poor children's tree is going to fall over. It did. It has. Many times it's fallen over. So I told them I'm going to take off the ornaments that are theirs and take off the ones that and I'm going to give it to them. And they can have their own children's tree. And then that way I could start a grandchild tree.
I was going to say, I think there's a grandchild tree coming up soon.
This can't fit, so I need to take all that. And I said, those are your ornaments, and they're your memories. They were memories together, but they were yours, and each of them are different because my kids, of course, are different. And I said, I'm going to box them up one time. I don't have the heart to do it yet, but I'm going to. And I said, I'm going to give it to you. And I have boys. And if you have boys, their sentimental value is not extraordinarily high.
Exactly, yeah.
He's like, yeah, what am I going to do with that? I was like, well, so I'm waiting until he had a child and then he sees a value and then he's getting his. The other one's not married. And we're going to be keeping those ornaments a little while longer, sure. And so I'll add other baby first Christmas and some other things that they did. So it just was by, I guess, necessity or nature. But I asked them, I'm not putting up trees. I'm too tired. I'm getting old. Which one do y'all want? And they all agreed. The children's tree is the only tree that they ever cared about. And so it really, it's good to see the memories.
Yeah.
It is.
Special. Special. All right. So my other little tidbit, sometimes in a great, like cops and robbers movies, there's a getaway car. But I heard that you have a getaway place.
Oh. And it has a tree.
It has a tree. Okay. Well, there we go.
That was the other tree.
Oh, okay. So tell me about the getaway place.
I do. Again, I tend to be an analytical person and that I'm not frivolous in many things, but hurricanes kept coming here, right? And for 30 years or more, I stay at the hospital when a hurricane comes. When you're the leader, you stay, or you were the clinician, you stay. And my children were small, and we always said that we needed a place that I always make my husband leave town. Now, my kids loved it. Again, I had 2 boys. They were 5.5 years apart, so they were like 2 only children. And I told them it would be really hard if I had to do the job I have to do, and I find you in my ER. Something fell on the house, the kid got hurt, something. I can't do what I do. You got to leave town. Now, my kids loved it. They called it Boys Club, and they did it from when they were little. And my parents were here, and they'd take the parents, and they'd hit a hotel along the way that you could find. And Boys Club was great. It meant going out to eat, ordering whatever you want, hotel swimming pool. Actually, they wouldn't even come back after the hurricane.
Can we stay a little longer?
It's been over. Anybody coming back? Somebody's got to manage the house. And so they had Boys Club all growing up. So we kept saying we were going to go somewhere where it was in central Louisiana, far enough away from hurricanes, and it's around the Natchitoches area. Unfortunately, by the time we were able to get that going, my parents were not able. My mom was, but my dad had passed away. But it's hard when you got to bring a couple, and your kids and your husband. And he was great about piling them all in. So now we went ahead and we got this place, and it was beat up. And I can't help it. I got to glamp it. They said I glamped it. I was like, I don't know what that is. Glamour camping,
Yep.
I was like, if
glamping.
you expect me to go, I'm not going to rough it because I work all the time and I would like it to be comfortable. So the first hurricane came after we had gotten it. My husband's used to getting on the road. He has a more flexible schedule. And he called my son, my oldest, and he said, look, you ready? We'll go meet by the lake. And he said, Dad, I'm in med school. I'm a resident. I can't go. And he said, oh. So then he called the second one, and he said, hey, you going to meet me at the lake? And he said, Dad, I'm working in the ER. He was a tech. I can't go. I got to work. Mike said, what am I supposed to do? I said, welcome to my world. I don't feel bad for you. So, however, it got to be Ida, and my husband took off, and my neighbors needed a place to be, and they have a large family. So they all go to this place in Natchitoches, by Natchitoches, and they're having a ball. Now, you know what Ida was doing to us.
Yeah.
And so both my kids lived out of town, and so the youngest one got to go. They're trying to send me pictures of their activities. And I will share in this. It went over badly, very badly, because they're fishing, they're cooking everything. They brought their freezer.
Right.
They're having a ball. They're, hitting golf balls off the porch and all that. This is the greatest time ever. We have no roof. We've got no electricity. We're flooding.
Oh, no.
I got to evacuate the hospital. I had to tell my husband one more thing. And look, you didn't even have, your phones didn't even work.
Yeah.
So when they finally worked and I'm trying to get help,
right.
it's going ding, ding, ding with all these pictures.
Oh, no.
The only thing I text back
no.
is, don't send me another thing. Right now's not a good time. He's like, okay.
I'm going to drop a bless his heart on there.
Yeah, you better
right
bless
now.
his heart. And so when you finally could get back through, he came back and my neighbors all stayed there. They had a ball. But then when he saw the condition of the town and our house got really hurt a lot, and I was like, I need help because I got to be at the hospital for the next month. We all stayed nonstop. And so he recognized that, and he said, "Can I go back to the lake?" I was like, "I dare you." That's all it says. I dare you. It will end ugly. When he saw
stay
it,
at the lake.
he understood. He understood. So
Yeah.
yes, we do. And I haven't had the opportunity to enjoy as much as I wish I could.
Mhm.
Escaping is not my strong suit. I
Yeah.
wish it was. But
Very
yes, we do. And we do like it. We're hoping with a little one,
Mhm.
we'll get a little more
Yes.
time.
Yeah.
That'll make it nice.
Very good.
A new appreciation.
I'm going to plan to ask you to get a getaway car to get to the getaway place.
Well, I drive fast.
All right.
Please, no policemen listen, but I do. I get there
Any
quick.
state highway patrol officers
Yes.
out there, ignore this car.
Exactly.
This is not the car you're looking for.
Mm-mm,
Right.
mm-mm. I go the speed limit.
There you go. Well, to close this out, we always like to ask for a piece of advice, a word of counsel, something that you would like to share with our listening and watching audience. Is there anything you'd like to say to this group?
Gosh, in your career path, surround yourself with amazing people, because that is a philosophy I truly live by. And I might have been young and not known. You always want your star to rise, but your star doesn't rise until the people around it does.
Oh,
And the reality is that the stronger they are, the better you are. You can't do it by yourself. And I have a lot of great people that I surround myself with, and they get the freedom to say and enhance whatever they need to. There's times I say, "Read my badge today. I get to be in charge." But many times I give them the freedom because they are so strong and they are so good. That the stronger they are is the ability that allows you to do other things. So if you think your star rises alone, you need to take that out of your head. Surround yourself with amazing people, and amazing things will happen. Truly.
100% agree. I would just go on file as saying that is what happens here at Fletcher. I have an amazing team who allows us to do amazing work for our community. And so, and I know that you as well have that amazing team at Terrebonne General Health System. So,
And I have an amazing board, that you
Yeah.
do too.
absolutely.
And I say that because you can have an amazing team to move things forward, but you also work with community members that may be aboard, and they've never, ever, ever, ever in my role have I ever had to compromise anything or limit any thoughts or processes. And that's what people ask me why I keep doing it, because I've never been asked to make a compromising decision or an ethical one that would be a challenge forever. They've always been extraordinarily supportive, and they let me still be the leader I need to be, and with the tenacity I need to have. And that keeps you motivated.
Yeah.
So surround yourself with amazement.
Wonderful. Thank you so much for joining us on the podcast today.
Absolutely. Thanks for having me.
Sure. And for those of you who are interested, I know we talked about some websites and some telephone numbers. Those will be found in our show notes. So be sure to check that out, especially if you are looking for any one of the amazing services offered by Terrebonne General Health System. This has been Bridging the Bayou, the podcast of Fletcher Technical Community College, and we look forward to seeing you soon. Thank you for listening to Bridging the Bayou, the podcast of Fletcher Technical Community College. Be sure to like and subscribe wherever you get your podcasts.